My name is Dennis Miller. I live in Waikiki. I support universal health care because I can't afford it the way it is right now. And it breaks my heart to see so many other people who go bankrupt when they get sick and they can't afford it either. And I know that there's a simple solution, and so I'm supporting universal health care because it's simple. Aloha.
My name is Carl Rocco. I live in District 41 and I support the universal health care. The reason why I do that is because I have too many friends who one trip to the doctor, they're $10,000, $20,000 in debt. So a simple solution would be the universal health care, and that's really all I have to say about that.
I'm Gail Breaky. I live in Waipio Gentry, I guess that's District 37, and I support universal health care because we really need it. Health care is expensive. There are too many people who are going to be in deep kimchi if the ACA is dropped. We really have to do it. It's the least expensive, the most comprehensive and reliable system that we could have, and it's doing well for many other countries. We need it.
My name's Ken Marcus. I live Windward Side, Kailua. I support universal health care for a variety of reasons. Simplest is just economics. It makes a lot of sense to eliminate the friction costs involved in the interposition of insurance companies. I want someone advocating for my care who does not have a profit incentive arrayed against me. And frankly, I think it makes sense for our economy as a whole. We're the only industrialized country that attempts to impose on employers the cost of insurance, cost of health care, I should say. And socializing that cost and reducing the cost overall only makes American business more competitive. And I think it makes sense. And unfortunately, the person who spoke a moment ago about the effect of lobbying put a finger on it, which is the leverage of lobbying interferes with our ability to make sound economic decisions. And it's about time we started making sound economic decisions.
My name is Ernest Carvalho, and I'm from the Chinatown, downtown Kalihi-Palama area, right? So I do support universal health care for many different varieties of reasons, but mainly because I believe that every single person is a human being, and we should be able to live a dignified life. We should be able to grow older, not worrying about having to pay this ridiculous amount of money or burdening our children with paying the costs for us. So that's my reasons.
I'm Reverend Dr. Donald K. Johnson, live in Kaneohe. I'm worried about, I have concern about the homeless, but then I also have a bit of righteous disgust that our elected officials provide health care for themselves at a very high rate, and all of us don't get to share in that.
I'm Kelly Almanza. I'm from Makakilo, the district of Kimberly Pine. I'm not sure the number. I support universal health care because if our congressmen, our senators, our presidents can have health care for them and deny it to the people who they work for, it's unacceptable, and we need to stand up and ensure that health care and mental health care is provided for all.
My name is Sally Lynn Skoog, and I lived here in Hawaii from 72 to 76 when I was in the Army Nurse Corps working at Tripler. And recently, my husband took a job here and we moved back. I live on Pi'ikoi Street now. And I am for the Affordable Care Act. I know it can be improved, but I speak for my daughter, who's an adjunct professor in Chicago. It's the first time she's been able to have health care for herself and her family. I have a son who's a musician in New York. He supports his family by bartending at several places, and he has insurance for the first time for himself and his family. And I think of the 20 million people who have health care insurance for the first time, and it breaks my heart to think that they don't know if they're going to be able to keep it. And I want to do everything I can to keep that insurance for all of those people, including my children and my grandchildren.
My name is Erin Fernandez. I live in District 18. I have a science background. We are organisms. Healthcare is our life and our being. And if we're denied healthcare, That's just absolutely ridiculous.
My name is Stella Berg. I live in Hawaii Kai, and I support universal health care because it makes the most sense and it's fair. We all deserve to live our lives knowing that we will be taken care of so that we can pursue our dreams. None of us knows how much health care we're going to end up consuming during our lives, so we might as well all get into the pool together and spread the risk around among everyone. Also, as a chief financial officer who loves efficiency and to get the most for our money, it really makes the most sense to get rid of all of the excess administrative costs and put all of the healthcare dollars towards health care.
Elton Johnson, Kaneohe. What strikes me is that we have a sort of a battle going on between two visions of things, and this is part of that. Is everything a profit sort of thing, or are there some things that are not commodities and that are, as some people say, rights? Are there some things that have such a value to all of us that we should share in helping one another in a public interest sort of fashion? I think healthcare is one of those, and for that reason I'm in favor of single payer. Thank you.
I'm from Eva Beach. I support universal health care because I feel like it's a human right. And when you think about it, if your house is burning down, the fire truck doesn't go to your house and look you up on a list and say, sorry, you don't have fire insurance, we're gonna let your house burn down. And if you're attacked in the street and a policeman's nearby, the policeman doesn't come to you and say, oh, sorry, you're not on the list for police insurance, you don't get any help, you just get beat up or killed. And why is healthcare any different?
I'm Betsy Brandt from Nuuanu. I support healthcare for all. I think that some areas in our life should not be governed by a for-profit motive, and that this is one of them. It's healthcare for all, and we should get the profit motive and, as what you said before, out of healthcare.
Sina, I think I'm in District 23, house-wise anyway, which is like Manoa, I guess, Lower Manoa. I have had health conditions where, because there wasn't getting the preventive care, I ended up costing the state a lot of money, California, not Hawaii, but as a child, so technically it wasn't my fault. But now trying to be proactive in getting my health care and looking at Medicaid as we are here today, there's some memo that somebody leaked that looks like an early draft to start axing Medicaid immediately, which we knew was going to happen. And I don't know all the details, but vigilance, as much as that could help us. But like everyone said, sorry, I'm going on. It's an industry, and there's so much money in it, and there's so much lobbying in it. And Howard Dean, God bless him, he's gone over to the dark side. I don't see progressives have to get the money out of this, because nobody is going to get the money out of this unless progressives can do it. There's too much money in it to commodify the bodies of poor and sick people. We make money off this country through sickness and death and war. Those are things that make money. Keeping people healthy is actually cheap. Why would we want to do that? Who's going to get money from that? I mean, sort of. I don't know. I mean, maybe Queens Medical Center has a different take. But I mean, once the ER closes, we're all going to be like, oh, nobody saw that coming. Well, it will be coming, because we're hitting the silver tsunami. Baby boomers will be aging rapidly. We're all close to that. I mean, at least within 50 years, we're close enough. So I don't know. It just not me. I'm close, but I'm sure there's a few babies here who don't know it quite yet, thank God. I don't know, I'm just, I'm discouraged, but I don't see any alternative but universal health care. It's not like, I mean, Humana is saying we're gonna opt out of the ACA. Everybody, Kaiser said we're no longer taking Quest last June, so it's not profitable is what they're saying. No, because we've made it, we've incentivized healthcare as an industry. So it's not really profitable for anybody to provide health care. We have to somehow make it profitable for people to not take lobbyist money. I don't know how to do that. I don't know how to think like that. I mean, I know how to think like that. we need some good policy people, like you said, and in primary, these holding the, these gatekeepers.
I want to say something about the Hawaii Health Authority roadmap, which is it would start with Medicaid. And the good things about Medicaid are that it has very comprehensive benefits, no deductibles, no co-payments. Everything that you need is covered. The drugs are covered, everything you need is covered. So we would start with Medicaid, and then we would take all the state, county, employee, and retiree health benefits, merge those with Medicaid, and raise the rates that they pay doctors a bit so that all the doctors would be willing to take it. And then you expand that to everyone else. That's basically the strategy. Start with Medicaid and build on that and improve the reimbursement so that everyone is participating.
My name is Ann Zellinger, and I'm from the North Shore of Oahu. And I support universal health care. And I really think we have to realize our own power in moving these decisions forward. First of all, our tax dollars are paying for Medicaid and Medicare and all of the things we may see in government that we do not like. So government, even though we think it's outside of us, we are paying for it, and they are representing us. They are public servants, and we have to take that power back and make our wishes known. So universal health care is an easy one because we all believe in having health care, and we all have the compassion that everyone needs health care. So it's an easy place to start, and I encourage people to be hopeful, not feel defeated.
Hi, I'm Daria Fand. I live in Honolulu in the Mo'ili'ili, Pava'a area, and I have Medicaid because I have a disability. And I tell people, I talk to other people in other countries, and I say, with Medicaid here, the only dental that I can get covered is to get my teeth yanked out. And they say, what kind of system does that to somebody? The other thing too is that my disability benefits rely on the fact that I can't work at all. So if I try, my doctor has said, if you try to work a little bit on your own at your own pace, this is the only way you could probably go back to work. Unfortunately, if I do that, I will lose my disability benefits, and along with that, my Medicaid. So essentially, I'm collecting Medicaid and staying on Medicaid in order to have health insurance at the cost of eventually maybe even being able to work at all. So I have all these skill sets that I'm not putting to use. I'm not paying into the system as a taxpayer anymore. And I personally feel as though there's a lot that I could be doing to be a citizen in the system and to participate in this economy. But because I'm simply living in order to collect Medicaid because I won't have a regular employer anymore, I'm cut out of the system. Think of all the talent that's being lost with people who have disabilities that could be out there participating if there was universal health care.
Anytime you come to a rally, you've done something, whether it seems like we've done anything here today or not, we have in fact done something because you've given education to the other people who are standing here with you, so thank you for that. I do want to say that no matter, I know that you guys have been fighting for your causes and for other things throughout your life and throughout this past year. So I just ask you to do one more thing. They say never end a rally without having an ask. So the ask is that you go ahead and look up Healthcare for All Hawaii on Facebook. We will put testimony so it's easy for you to just cut and paste your own testimony. We'll let you know when the bill is scheduled through the Ways and Means Committee, and we'll make it as easy as possible, but that ask is that you do support it and you send in something. It makes a difference. Whether or not people believe it, it truly does make a difference to have your voice heard. So that is my ask. Thank you very much.
Love it, improve it, Medicare for all. Love it, improve it,
Medicare for all.
Love it, improve it, Medicare for all. Love it. it, Medicare for all. Love it, improve it, Medicare for all. Love it, improve it.